This conference will now be recorded.
All right. Well, we're glad to have everybody who's here. It looks like we've got quite a few people. We've got about 4 of us here. Welcome, Andrew. 2 of them, I think, are me, but that's okay. Just trying to work with technology.
Welcome, Josie.
We are so glad to have Brittni Clark from St. Mark's Hospital. She's part of their trauma care and unit. You can explain a little more about it, but she's going to give us a really awesome presentation on first aid kits and the basics of first aid, especially for businesses. And so take it away, Brittni. Do you want to be presenter? I can make you presenter too.
Yeah, that would be wonderful.
All right.
Sorry, I'm trying to set up a webcam. There we go. Okay. Let's share that. Oh, sorry. Let's do this again.
No worries. Technology has its own little quirks.
Gotta love it. Okay, do I have the option to, there we go. I'm just trying to figure out if I can share my other screen. Let's see here. Because you guys see that one. Can you let me share again? I think you had to.
See, I've made you the presenter. Let me try making you the organizer and we'll see how that goes. Try that.
Oh, I'm so sorry.
No worries, no worries.
Oh, there we go. Display setting. How's that? Better?
That's great.
Yep, that looks
perfect. Awesome. Okay. Sorry about that technical difficulties. That seems to happen everywhere I go, so I apologize. Like Josie said, my name is Brittni Clark. I am the Trauma Outreach Injury Prevention Coordinator here at St. Mark's. I work in their trauma department. We are a level 2 trauma facility, and what that means basically for our public and the Millcreek is we are a designated trauma center by the American College of Surgeons as a level 2. And we can take care of any critical patients just like any other trauma center in the Valley. So just like the university and IMC, we work great as a team, and our trauma system here within the Valley is just amazing to work with. So we're very fortunate in Millcreek to have St. Mark's as a designated trauma center. So way to go, St. Mark's. And I am here today to kind of talk to you about first aid kits for your business. It's primarily just a general topic or talk on it. Every business is actually going to be a little bit different on what they may need in their first aid kit, but we will go ahead and just kind of go through. So first things first, you really want to kind of determine what type of business we are at. So for example, a construction company is going to be a little bit different than an office company on what things they should have in their first aid kit. Same thing if there's a lot of traveling versus just being stationary. So like at a construction site, you might have more things geared towards outdoorsy, more crush injuries. And whereas in the office, hopefully you're not getting too many crush injuries and all that in the office place. If you are, then we need to redo your title. But you really want to kind of think about what you need to be prepared for. What if something can go wrong, what will go wrong? Is your office located in a major intersection? Do you have a lot of traffic in that area to where you'd see car crashes? What types of emergencies might you be seeing around your workplace? So what essentials do we need in a basic first aid kit? So if you were to think of just going to Walmart or Walgreens, just buying a $9.99 basic first aid kit, the things that I've seen most commonly are just gauze, Band-Aids, maybe some cute little plastic tweezers, some more gauze, some gloves, and just like stuff to help with minor bleeding, which is amazing because when you need something and you have it there, that's perfect. I did some research, and some of the basic first aid items that I would encourage people to kind of look upon, even in your office setting, of course. Number one, Band-Aids. Can never go wrong with Band-Aids. Also, I suggest getting different sizes of Band-Aids, just because you never know what type of wound you may have. Then gauze, we have at Walgreens. If you ever go into Walgreens and go into their pharmacy section, they have a wonderful display of wound care items. And if you're lucky, usually every other week, it's buy one, get one half off. So if you're creating your own basic first aid kit, I highly encourage you to check out CVS or Walgreens. Their wound care selection is, I've been certainly impressed with that. So just your usual gauze. You can be 4x4. It can be one that's Z-folded and a long strip. Just get some gauze to kind of help with that bleeding. We then have quick clot or combat gauze. I have some right here. What this is it's just like that gauze that's up there on the PowerPoint, but it is a special gauze that's impregnated with kaolin chemical that helps kind of clot off your blood. So on contact, it's going to kind of help stop that bleeding if you have any major bleeding, which in the next slide or two, I'll talk about kind of more in depth on that a little bit too. So, of course, you have that rolled gauze, the lovely Band-Aid brand. And a lot of people will ask me if there's a certain brand or certain item. I know cost is a big factor with first aid kits, and so if it's the Equate brand from Walmart, that will work just as good as any other type of the Band-Aid or any name brand as well. So we then have, this is just a snapshot actually from one of the first aid kits from Walmart. I went on to walmart.com and I was just kind of browsing what they had in their selections. And I kind of liked this one because in a basic first aid kit, it's not going to be all about bleeding. You can trip and fall, twist your ankle. There's all different sorts. And so in this first aid kit, I really like this picture because it has gloves. And then it has a cold compress. So if you just need to put a cold compress on an ankle or wrist, that's available. It's got some tape, some Neosporin, different sizes of Band-Aids, some gauze, some smaller gauze, those little wooden tongue depressors to help put that Neosporin on so you don't have to use your fingers per se. But this is just, I believe this was the $9.99 one or $9.97 one from Walmart. And I like this kit because it's a great basic first aid kit if you're just looking for the bare minimum of just having something there for your minor emergencies. And then the great thing with this is you can build off of it. So I tell people in my Stop the Bleed class, just go get a basic first aid kit and then we can build a trauma kit off of that. So I will talk about that here shortly too. Those lovely little trauma, we call them trauma shears. They come in different sizes. These are a little bit more durable than just regular scissors. I like these just because they can seem to cut about anything and they're pretty small. Of course, in my basic first aid kit, Advil, Tylenol, you always want to be sure that pain control, ibuprofen, Tylenol, acetaminophen, and a lot of the first aid kits, they do have those little packets. The one thing you need to remember, though, is they could expire, so make sure you're always checking those expiration dates every now and then. Those life-saving tweezers, which are actually come in pretty handy if you're outdoors and you come across a thorn or something that, it's a minor injury, but, it's uncomfortable. So those little tedious things that you may need will help with that. Let's see what else we got here. Life-saving Sharpie. We'll talk a little bit about that here shortly. And then, especially here in Utah, I always encourage people maybe to have some burn cream or some bug repellent, insect bite, sting relief. Also, in my first aid kit that I have, my basic first aid kit at home, I also have Benadryl for my kiddos. Just because if they do get stung by a bee or wasp and they start having inflammation, there's Benadryl to help with that, to kind of decrease that. So, like I said, this is such a broad topic because it's going to differ from place to place of business. And so, what I encourage people, if you're just looking to do a basic first aid kit, just go online, Walmart, Target, and just look at their basic first aid kits and then build off of it. So, there we go. So do we need any advanced items? And so these are tools that if you have more significant injuries, life-threatening bleeding, if you have a sucking chest wound, like a gunshot wound, something. I know a lot of places you may not think of that, but I'm a trauma nurse, so I think about everything. Unfortunately, in my hometown in Nebraska, last weekend we just had a shooting outside of a movie theater over the weekend, and 2 people were injured. So just going out and about, you have to just think, unfortunately, in this day and age, we have to think about everything that could go wrong. And I'm the trauma nerd in the hospital that I think about, you know, if I'm going across the street to grab some McDonald's, Starbucks from the hospital, there's that busy intersection. What happens if somebody doesn't see the stoplight and you crash? Everybody goes to work by car or even, you know, the train. And so you just kind of have to think, you know, you don't plan on accidents. And so with me, I have a tourniquet. These are different types of tourniquets, and we'll kind of talk a little bit about that. So a tourniquet is a device that's used to stop life-threatening bleeding from an arm or leg. There's many different types. I am partial to the CAT tourniquet or the combat application tourniquet. That's that blue, black, and orange picture right there. You then have the soft tourniquet, which is that black one, and then the RAT tourniquet, which is a rapid application tourniquet. I have the CAT tourniquet and the RAT tourniquet. The CAT tourniquet is great. I have it in my car, my office, my purse. This stops life-threatening bleeding. It's easy to use and can be applied quickly. The RAT tourniquet is really nice because it gets really small, and I put it in my hiking bag when we go hiking. And the only difference between those is this doesn't really have any rubber or anything. It essentially never expires. You can't really see it since I'm in black there. It never expires. The RAT tourniquet, if you look at that picture, it's wonderful, but the inside is rubber. And so over time, that rubber can kind of decay. So I'd encourage you to just kind of go we'll talk about some different places where you can buy these, and just kind of look at them. And just these, again, stop life-threatening bleeding from an arm or leg. So if you're on a motorcycle, if you like to ride dirt bikes, ATVs for fun, I highly encourage you throw this into your first aid bag. The great thing is there's many different types, but what you want to do is to make sure you know how to use it. Every single one of these tourniquets comes with a little instructions. And so make sure you get those out and you just know how to use it. Because you don't want to be in the middle of an emergency, bleeding emergency, trying to read these instructions while somebody is screaming in pain, and it's just so chaotic. So I encourage you just to get whatever you would feel comfortable with and know how to use them. If you ever have any questions at the end of this presentation, I have my contact information. Feel free to reach out to me. We then have the splint. So my husband is an avid skier, and he likes to do things that me as a trauma nurse kind of skips my heart racing a little bit. So in his little trauma bag I bought, he has some splinting materials, because one of these times he's gonna bite off more than he can chew. So many different areas in this or shops and stuff have different splinting materials, even just an ACE bandage to kind of help that, especially with hiking. You fall and you can break your ankle. I know over the summer I've seen quite a few stories about how hikers have fallen and rescuers have had to go and get them because they have no way to move because their leg is unfortunately broken and there's no way to stabilize that. So I always encourage, think about what you're doing, where you're at. So lovely ACE bandage. The ACE bandage is also really good for life-threatening bleeding, to apply pressure to that. We'll talk a little bit more about that. And then in a lot of the advanced trauma kits or first aid kits, they have what's called a chest seal, and these are for your sucking chest injuries. So your gunshot wounds, stabbings, and what it is it's essentially a dressing that has a little vent in it so that it helps your lung expand and still be able to breathe. All of these, if you think about it, we're just, what am I wanting to say? We are just helping the victim or the patient. We aren't essentially completely treating them. We're just stabilizing them. And so, again, if you have to use any of these advanced equipment, I encourage you to go directly to a hospital, especially tourniquet, chest seal, of course, those bleeding injuries, a splint. If you're having to use a splint and you have a deformity, you need to get to an emergency room right away. These are all more advanced injuries that an ER physician needs to be seeing you for. So like a lot of your activities here in Utah, I absolutely love this state because there is so much to do. Even in the winter time, if you're bored, you can go find something to do. But then the trauma nurse in me is we have to prepare for what could happen. CPR shield, basic first aid or life support. This is, I believe this is just to help with breathing. It helps kind of shield, especially if you don't want those germs. So the most important thing you need to know is how to use your tools. And I have a video here. I don't know, Josie, if you want me to show the video. The video shows just basically how to properly put on a tourniquet. I'm more than happy to show you as well.
Sure, yeah, and I think anything can be very helpful, so yeah.
Okay, let's see if this plays for you and if it works. Can you hear this okay, guys?
I can hear it. It's buffering just a little, but
in life-threatening situations, the items in this bleeding control kit are designed to provide you with simple yet essential medical equipment to stop severe bleeding. Empower anyone to assist in life-threatening situations. Now you can easily prepare yourself for the unexpected. Lives are depending on it. Gloves should be worn during the application. To begin, remove the cat from the bleeding control kit. For best results, expose the skin where the wound is located. For this two-handed application, pull the band out of the cat buckle. Route the band around the limb. Position the cat 2 to 3 inches above the bleeding site. Apply directly to the skin. Pass the red tip through the slit of the buckle. Pull the band tightly and fasten it back on itself all the way around the limb, but not over the rod clips. The band should be tight enough that the tips of 3 fingers cannot slide between the band and the limb. If the tips of 3 fingers slide under the band, retighten and re-secure. Twist the rod until the bleeding has stopped. Secure the rod inside a clip to lock it in place. Check for bleeding and distal pulse. If bleeding is not controlled or a distal pulse is present, consider additional tightening or applying a second cap above and side by side to the first. Reassess. Secure rod and band with time strap. Record time of application on the time strap with the permanent marker included in the kit.
That life-saving permanent marker.
Assure the patient that help is on the way. Combat application.
All right. So that is just kind of a gist of of how to apply a tourniquet. Like I said, with major life-threatening bleeding, basically, so I teach a class every other month, free, absolutely free to the public here at St. Mark's Hospital. It's called Stop the Bleed. It is a worldwide campaign by all trauma centers. We teach it, and it teaches you what to do in a bleeding emergency. It originated after the Sandy Hook school shooting, when the trauma surgeon on call determined that all those kiddos' lives could have been saved with the proper bleeding control techniques that we teach in the class. So any life-threatening bleeding, which is essentially blood pooling on the ground, if it won't stop coming out of the wound, basically if it's a large, if you look at the wound and you think, wow, that's a lot of blood, that's a lot of blood. So that's a bleeding emergency. A person who is bleeding from an artery can die in as little as 3 minutes, so that is a true emergency. Unfortunately, we see it a lot with car crashes and motorcycle crashes. But this is that quick clot gauze that I was talking about. It's essentially a gauze that, when I said it's Z-folded, it's just kind of like an accordion fold. That way it can help you if you need to pack a wound or if you're just putting direct pressure on a wound. And then that tourniquet, like I was explaining, get whatever tourniquet you want, and then just know how to use it. So like the video showed, just know how to use it. The instructions are fantastic. And so just know how to use the tools that are within your kit. And so, for example, for time's sake, I won't demonstrate how to use the tourniquet since we watched that video on how to apply it. But I will show you how to do, if you don't have a tourniquet, what we need to do for life-threatening bleeding here. So if you don't have a tourniquet, but let's say you work in an office, there's a car crash, you don't have a tourniquet, but you do have that lovely gauze that I was talking about. So can you see this? Okay, there we go. So this is my lovely task trainer that I take to all of my bleeding control classes. And this is a wound that we practice with a lot. You see it a lot. It's deep, it's long. So there's two ways that you can control this bleeding. So if there's bleeding coming out from it, you take your gauze, for direct pressure, you literally just put the gauze directly over that wound, and you're going to apply continuous pressure until help arrives. You want to push down as hard as you can until that bleeding stops, until that EMS personnel comes. The first thing you're going to do when you see a bleeding emergency is make sure somebody's calling 911 to get help to you. If the wound is large and deep, like this, for example, earlier I said if you need to pack a wound, this is great for it. To pack a wound, if it's large and deep, you literally just stuff your gauze into that wound. I know it sounds icky, but this is going to apply pressure on internal arteries and vessels that are bleeding to help stop that bleeding. Once you can't get any more in, you apply direct pressure until help arrives. Basically, pressure is your friend. And so if you see somebody bleeding, just like our little paper cuts that we get with those little Band-Aids that we need in our first aid kit, you apply pressure, put a Band-Aid on, and go about your day. Same concept with just a bigger wound. You're just going to apply pressure and help stop that bleeding. So if you don't have a tourniquet, use that gauze that you have in your lovely first aid kit, and we're going to apply pressure and control that bleeding that way. All right. So I kind of talked a little bit about different types of tools and instruments that we have within our first aid kits. You make it how you want it. There's many different types of kits out there. There's hundreds of kits you can make and create and make it your own, which is the great thing about emergencies medicine is it's a team effort. And so if you ever have any questions, you can ask. I have some different areas here that are local and kind of get their feel, this is where we work. What do you suggest? And they're really great. But where do we get our first aid kits and our items for our first aid kits? So the lovely Shields, CVS, Walgreens, Walmart, Target, they're fantastic. Shields has their first aid kit up in their camping department. CVS, Walgreens, their wound care. If you're creating your own, like I said, look for those deals. Walmart and Target, I want to say they actually have where if you buy all the basic essentials for the first aid kit, then they actually will give you a free first aid kit case to go with it. And so they promote that very well. And then the lovely Amazon. We can't forget Amazon. You can buy everything on Amazon. The one thing that I will say though, if you're buying those advanced tools like tourniquets, the chest seals, everything like that, make sure you know where you're buying from. They do sell fake tourniquets on Amazon, so that just means that the materials aren't as strong. So when it comes to medical supplies, I always say cheaper is not always better. If the deal sounds too good to be true, then it probably is too good to be true. A basic cat tourniquet should be around $29.99. If it's still $29.99, but it doesn't look right, it could still be fake. So you just want to make sure that the proper branding is on that, saying what it is, if there's a lot number, stuff like that. So I encourage people, if you're buying from Amazon, I love Amazon. I unfortunately use it every day. But just know that there are, like any other thing, fake items. So just be careful with that. MyMedic. This is located in Murray, or you can just go on to mymedic.com. I was browsing online. This is where I bought my trauma kits for my husband and myself. They will personalize any type of first aid kit to help meet your needs. They are fantastic to work with. They're local within the valley. And they can offer a lot of insight as well. So if you ever have any questions, they're fantastic to work with. If you go to mymedic.com, they have so many different types of first aid kits. And they have some that if you're in a construction zone, this is what they suggest for your construction zone. Just different things like that. I was really, really impressed with how in-depth, and it tells you everything that's within the kit. So if you can even just go on and look and see what they have in their kit, and then go to Walgreens and see what specific things you want that way, if you want to build it that way. Great examples there. Of course, a Stop the Bleed kit, trauma kit, which has gloves, a little permanent marker, tourniquet, gauze, and an ACE bandage, all in a little kit. I have one of these in my car, and I have one of them at my desk. Stopthebleed.org. You can buy them on there. They're about $69. The MyMedic ones range from $50 to way up there. But they are local, and they will work with your business. If you're buying multiple ones, they will work with you and help create what best helps your business, what you're looking for. So with Stop the Bleed, you can also just buy individual tourniquets from them. That is the main hub of my campaign. My next Stop the Bleed class is actually August 11th, tomorrow, August 11th. At 6 o'clock here. The one, let's see, in October, it's going to be October 13th at 6 p.m. here at St. Mark's. So, like I said, we offer that free bleeding control class. It's an hour long. Learn to save a life. It's free. If you ever want to learn how to use a tourniquet, anything like that, but that is for bleeding emergencies. And that is free to the public. And then I also do go to workplaces and businesses and teach it too. NA Rescue. So they are a company based out of Colorado. they also create bleeding control kits, advanced first aid kits. So narescue.com, they have multiple ones. You can also just buy individual tourniquets from them. They, I believe, are also on Amazon. So if you go on to Amazon and see that it's sold by NA Rescue, that I would say is probably legit, because North American Rescue is based out of Colorado. I've bought stuff from them and it is legit. But yeah, again, like I said, join us. I offer free Stop the Bleed classes. I go to businesses. I'm going to be going to a construction company here at the end of the month. We have a great time and learn how to save a life. But yeah, that is my presentation. I want to thank you guys so much for tuning in. I guess Andrew, Josie, do you guys have any questions or anything?
No, I've taken your Stop the Bleed class and it was fantastic. So I recommend anybody take it. Yeah, no, it was great.
Yes, and I do know we offer the CERT class. I don't know the specifics if we're doing that. I think Andrew, you might have that. That's where you become disaster.
We're sure to do that in the fall here, probably September, end of September into October, November.
Yeah. So if there's any businesses
that schedule here.
Yes, I highly recommend the CERT class. I love that. I love sitting in on that. So there are resources available. Always feel free to reach out to me. My email and my cell phone number is up on the presentation there. If there's any questions that you ever have, feel free to reach out. If I don't know the answer, I will figure out how to find the answer for us, because I'm the type of person that needs to know the answer as well. So if there's ever any type of education or anything that I can help with, I'm more than happy to come to your business or talk with Andrew or Josie, and we can just have a party. So thank you so much for tuning in. I hope you enjoyed my presentation. And if you have any questions, please feel free to reach out. Have a great day.
Thanks, Brittni.
Thanks,
Brittni.
Thanks, Andrew.